Hello, thank you for watching our presentation today. My name is Dr. Mary Lufanek, and together with my colleague Dr. Michael Caruana-Dingley, I am going to explore the importance of diet for healthy blood. So what is blood exactly? It's a mixture of multiple cells and the substances needed to sustain them and help us stay alive and healthy.
So what is present in our blood? It is primarily made up of three cellular components: the red blood cells, which carry oxygen to our organs, the white blood cells, which defend us from infection, and the platelets, which help our blood to clot and stop bleeds. These cells exist within a liquid component called plasma that is rich in sugar and essential salts that are vital to keep these cells alive and our organs to function properly.
So why is blood so important? It is the reason why our cells can maintain their function. They are responsible for carrying essential nutrients to our major body organs and for removing the toxic waste created as a byproduct of metabolism. So essentially, blood is the major transport medium in our body.
Anemia is a situation in which red blood cells are at lower levels than normal. It can occur due to numerous causes and is one of the commonest conditions seen in our clinic.
What should I expect if I suffer from this condition? The symptoms can be very vague and they can vary. The commonest presentation, however, includes feeling tired and noticing yourself to be paler than usual. Some may also complain of shortness of breath, especially on exertion, and feeling their heart racing. Dizziness, headaches, and difficulty in concentration may also be very common presentations.
The people most at risk of developing anemia include women, particularly during their menstruation, children in view of their high nutritional requirements for growth, and the elderly as a consequence of poor diet and multiple chronic diseases. It is worth mentioning that people on blood thinners like warfarin are at increased risk of bleeding and consequently anemia.
How can one get anemia? There are three main reasons associated with it. The first is, for some reason or another, the bone marrow, which is the site of the production for your red blood cells, is not producing enough cells. This could be secondary to nutritional deficiencies, failure of the bone marrow, infection, and drugs like chemotherapy or malignancy. The second cause would be normal production of the red blood cells, but which in turn are broken down at a faster rate. Reasons for this could include conditions which occur with birth, such as thalassemia and sickle cell anemia. Thalassemia and sickle cell anemia both involve defects in the hemoglobin, which is an essential component of red blood cells for the transport of oxygen. As a result of this defect, they are more likely to be broken down by the spleen. Any causes of enlarged spleen will also cause increased cell breakdown. Finally, anemia can occur in view of blood loss, which is especially common via the gastrointestinal tract, example due to hemorrhoids. This can also occur due to menstruation and as a complication of surgery.
So, how can you know if you have anemia? Simple blood tests ordered by your GP, such as a complete blood count or blood picture, can reveal the presence of a reduced number of red cells, as well as abnormalities in the red cells that could point to the cause of your anemia. In some situations, more complicated tests will be required, and these could include further blood tests to check for dietary deficiencies or minor surgical procedures, such as scopes looking for sites of bleeding in the GI tract. The treatment of anemia is in the majority of cases with simple dietary modifications and supplementations. However, some anemias will require more complicated treatments, including surgical closure of bleeding sites or intravenous iron supplementation. In some situations, such as chronic kidney diseases, where the underlying condition cannot be optimized further, occasional transfusions may be required to maintain healthy red cell levels. So, can anemia be avoided in any way? As you may have guessed, diet plays a very important role. An imbalance in diet is by far the commonest cause of anemia, and within our diet it is the lack of iron, vitamin B12, and folic acid that are most often to blame. Folic acid, or folate, can easily be obtained by ensuring a diet which is rich in leafy green vegetables, fortified breakfast cereals, chickpeas, or kidney beans. Vitamin B12, on the other hand, can be found in eggs, milk, fish, cheese, and most red meats. Last but not least, iron can be obtained through most red meat, beans, nuts, soy, and iron-fortified cereals. Oranges, lemons, strawberries, and kiwis are rich in vitamin C, which is essential to good iron absorption. On the other hand, caffeine-rich beverages like teas and coffees may reduce iron uptake.
But what if diet is not enough? There are multiple options for oral supplementation, such as Ferrograd, Globifere, Tatima, and Ferroglobin. These can be acquired from your local pharmacy as prescribed by your physician. These drugs are relatively safe. However, some side effects may be related to them. Most commonly, this includes nausea and constipation, as well as stomach cramps. Patients also notice black stool, but this is not something to worry about. Iron tablets are best taken on an empty stomach to maximize absorption and separated from caffeine-rich beverages by at least 2 hours. While it is best that they are swallowed with a glass of orange juice, they can also be taken with water. They should, however, not be chewed as they can stain your teeth. Whenever you're unsure, do not hesitate to contact your doctor or your pharmacist. In certain circumstances, iron tablets are not enough to increase our body iron stores, and therefore it would require that the patient is admitted in hospital and iron is given intravenously over 5 days.
However, anemia is not always due to diet. In these cases, a full workup by your caring doctor for potential problems such as arthritis, slow thyroid, blood loss, and possible malignancies would be required. When in doubt, trust your caring physician to guide you. When needed, they can consult other specialties like gastroenterology and hematology for guidance.
Now we would like to tackle some frequent misconceptions about this very common condition. First of all, are all anemias the same? The answer is no. There are three main kinds of anemia, which are mainly differentiated by the size of the red blood cell produced. Microcytic anemia is the kind associated with iron deficiency, but it can also occur in conditions like thalassemia and sickle cell anemia. In microcytic anemia, the red blood cells which are produced are smaller in size than normal red blood cells. Conversely, in macrocytic anemia, the red blood cells produced are larger in size, and these can be associated with vitamin B12 and folic acid deficiency, as well as alcohol misuse and hypothyroidism. In normocytic anemia, the size of the red blood cells is maintained, and this could be due to chronic diseases or multiple vitamin deficiencies, which can coexist. In these cases, the mix of small and large red blood cells can fool the analyzer into thinking that they are normal sized.
So, are all vegetarians and vegans anemic? Through a proper balanced diet, essential minerals and vitamins, usually obtained from red meat, can be supplemented with non-meat products like tofu, beans, and green leafy vegetables. It is very important that when excluding red meat from diet, one is well informed of how to obtain these essential substances. When in doubt, consult specialist dietitians who can help guide you on a balanced meat-free diet. So, my iron levels are now back to normal. Can I just stop my treatment? Usually, after taking medication for anemia, a repeat blood test is taken to check whether the iron level has been restored. If the result for the iron level comes back normal, one might be tempted to simply stop their treatment. However, when we supplement iron in the form of oral treatment, we are not looking only to increase the iron level in the blood, but also the iron stores in our bones. Hence, it is very important to continue supplementation for at least 6 months. That concludes our presentation. Thank you for your attention.
We would also like to remind you to donate blood when you can. Thank you.